Uganda is taking bold steps to tackle pollution through the Environmental Pollution Program in Uganda, also known as Epp Ug. This initiative has delivered impactful results aimed at protecting public health and environment.
For Uganda, for the Health and Pollution Action Plan, we developed a preliminary assessment report, but we started this with a number of priorities, including waste management, air pollution, water pollution, contaminated sites, heavy metal pollution.
One of the program's key achievements is the development of Uganda's Health and Pollution Action Plan, a national roadmap that identifies major pollution sources and outlines practical evidence-based solutions.
It has taken steps over the past 5 years to address Uganda's growing pollution challenges, including, among other things, the passing of the National Environment Act and the introduction of the National Environment Air Quality Standards Regulations. We also know that NEMA has been proactive in leading cross-government initiatives in this space. This framework gives us confidence that we will be able to work effectively with you on pollution control that yields the greatest benefits to health and the environment.
This plan provides a strong foundation for coordinated action against sectors. To better understand air pollution, a source appointment study was conducted, focusing on traffic-related emissions in Kampala. This research has helped identify the major contributors to poor air quality, enabling more targeted interventions.
It's very difficult to find a place that has very acceptable clean air levels in line with the World Health Organizations. So it shows that we need to take action.
We have issues of indoor pollution where we have rural communities where they still cook indoors using biomass, or where in some cases we have communities where animals reside near homesteads or inside home dwellings. We have emissions from constructions. We have issues of water pollution where we have discharge of partially treated effluents or discharge of improperly treated sewage from pit latrines or from sewage treatment facilities.
We realize that these communities are being affected by heavy metal pollution from the activities they do, like metal smelting and fabrication, activities like the use of lead paint within the communities, and even some of the daily activities that happen in our houses, like water coming from the pipes. These pipes do contain a lead, and it's affecting the people's health.
In addition, Kampala's air quality monitoring network has been significantly expanded with the installation of 38 monitoring devices. These systems provide real-time data, improving the country's ability to track pollution levels and respond effectively.
This action plan, the issues we have identified, the actions, once they are implemented, we should be able to add something to addressing some of these issues. In NEMA, we have definitely done a lot as our mandate. We have a number of regulations in waste management regulation. We have air pollution regulation in 2024. But the issue is enforcing these regulations. That has been the issue. And therefore, I want to think that with this action plan, with the strategies we have put in place, this project, this action plan will support the enforcement of these regulations.
Public awareness has also been a major focus. Through civil society-led campaigns, communities in the Greater Kampala metropolitan area have been educated about pollution risks and how to reduce exposure, empowering citizens to take action.
No single ministry, not even NEMA, which is an agency of the Ministry of Water and Environment, can tackle this challenge of pollution alone. So to my comrades from the government MDAs, we do need pollution and health metrics to be integrated into the physical planning, industrial licensing, and agricultural policies of the country.
As KCCA, we do collect waste. We take all necessary measures and reasonable practicable measures to maintain cleanness of the city.
The program also reviewed key waste management and agricultural policies, integrating important considerations such as gender equality, social inclusion, poverty, and health.
Once this document is signed, because the next step is, yes, revise all the comments, conclude a strong draft, which will no longer be a draft, it will be a final document, and then this to be signed by NEMA. If NEMA signs the document, which means they validate it with a signature, then we consider this is official.
This ensures that solutions are fair and benefit all Ugandans, especially vulnerable groups.
Our theory of change encompasses three things mostly. One is to support and to build political willingness, because of course if there is not endorsement and collaboration from the government, things won't be sustainable and can change. The other is, as I mentioned, is to produce really the science and the evidences on why we do this and why we do it this way.
Furthermore, studies on the economic impact of pollution have highlighted the financial burden pollution places on the country, strengthening the case for urgent intervention.
When plastics are burnt, they release a very toxic air, they release a very toxic smoke, and that smoke is very, very dangerous to our health, especially if we continue inhaling it.
Pollution is driving most death in Uganda. We have realized that people in Kampala are burning waste.
If this pollution is generated in terms of solid waste and also in terms of liquid waste, and it's managed properly, it would not be a problem.
Let's approach the Ministry of Finance, let's approach development partners so that they're able to give us resources. It is worth resources so that we are able to start moving. Let's not stop.
Finally, training programs on the safe use of agrochemicals have equipped farmers and stakeholders with knowledge to reduce harmful practices and protect both human health and the environment.
We must strengthen coordinated action because we all have a role in reducing air pollution to safeguard the air we breathe.
Together, these achievements mark a significant step forward in Uganda's journey toward a cleaner, healthier, and more sustainable future.